try and keep my passion down so I can speak, but this is what we're all about, and we care a lot about educating clients, and that's what I'm going to try and do today. So the topic is one that we often get asked about. What's the difference between testing and validation? I'm going to try and break that down for you into easy pieces so that you'll be able to see the similarities and the differences in validation and testing. So we're going to start with when validation actually begins, and some of you may find this kind of surprising, since when we're talking about validation, we're thinking, oh, validation is the end of the project. I don't have to think of it until the end. But in reality, the FDA, and when we wrote the ISBT guidelines, the guidelines specify that actually validation testing is a quality assurance activity that should start when the decision is made to purchase or make a significant change to an automated system in blood banking. Well, I mean, you can't be validating with testing and test plans and those kinds of activities in the beginning of a project when you've just selected a vendor or you've decided to take an upgrade. So actually, what am I talking about, and what are we trying to do here? So on this slide, we're saying that what we're trying to do is to ensure quality is built into the software during each life cycle phase by going through testing and validation. In the beginning, here is the life cycle in order to maintain a validated state or a state of control for your system. And you'll see that this life cycle, which we've actually illustrated in a cyclic type diagram, is different than your vendor's life cycle. I mean, their life cycle starts with planning what they're going to build, actually building what they said they were going to build, testing it, and then doing a final validation on the release. But your validation activities, in order to maintain a state of control, start with you having user requirements, specifications. Basically, what is it that you expect the system to do for you, and how does it allow you to maintain your state of control in order to show that to the accrediting agencies, and so that your project will go very smoothly. So after you have user requirement specifications, this box up here, the next thing is to take those requirements and actually do a risk assessment to find out where the highest risk is in your system. And those are the things that you want to concentrate more heavily on, things that are actually risky and could either injure or kill a patient. So it's very important to have a risk assessment that you do. And from that risk assessment, then you can qualify the vendor, and this is the validation activity we're talking about when you've purchased the system and it's time, or actually before you've even purchased the system in the case of a brand new system, to look at those requirements that you're trying to maintain in your system and have an idea of where the risk is in the system, so that you can adequately stress those things that are going to actually hurt someone. And qualifying your vendor or your supplier is a very important piece of activity that you do to make sure that not only your vendor or your supplier, whichever you call them, has all of the functional aspects that you need in order to meet your requirements for daily work in the blood bank, but also to make sure that they've maintained their GMPs, or their good manufacturing practices. So this is actually, this step right here, supplier qualification, which should be done actually before you sign a contract with your vendor, and before you actually decide to put in an upgrade, is where you make sure that, yeah, this vendor knows what they're doing as far as their quality assurance in their own company. They follow their quality assurance plans, and they have good manufacturing practices. And for more information about supplier qualification, by the way, I just recently published an article in Master Control, which you can find on the internet, and it is about qualifying your supplier. So you can get more information about that. Today we're talking about testing and validation, but what I really wanted to show you with this diagram is that we say after we qualify the supplier and actually get the software and start configuring it, that performing good testing, good unit testing, or good, you could call it pre-validation testing, unit testing. It's called many different things, but what it's doing is very important. We're going to discuss that in more detail in a minute. What I really want you to notice on this slide is that I have a red line that says freeze database. And so you'll see that before the red line in the cycle is perform good unit testing. After the red line, freeze database, is where we talk about validation. Perform your validation plan, the next block on this cyclic diagram. So for the rest of the discussion, while we talk about testing and validation, similarities and differences, etc., I like you to remember this cycle. And remember that before the freeze database line is where we're saying perform good unit or pre-validation testing. After that line, we're talking about validation, because that will become critical when we talk about the similarities and the differences between testing and validation. And just to continue along the cycle so that no one says I forgot the other activities that assure that you're maintaining a state of control in your system, also on this cycle is having a training plan and making sure your people are trained and competent to perform in the system. Having an emergency dropback plan if something should go wrong with the software implementation and you find something that's maybe a real showstopper, you can't go live with this version of the software and you have to drop back to an earlier version. You have to have some sort of a plan that allows you to do that. And continuing on the cycle and going around again to the user requirements, continue to use good change control. And if you follow the steps on this cycle, then you'll be assured that your system is in a state of control. And every activity on this cycle is very important. But today we're discussing the two down in the bottom: perform good unit testing, freeze, and then validation. Okay, so we're going to talk more about those now. So what are the similarities between testing and validation? Because actually there's quite a bit that's similar. The testing is actually a validation done during the configuration phase of the project. So the phase of the project when you're setting up all the tables, you're setting up those patterns for conclusions so that the system predicts the proper result for a pattern of testing. You're setting up all of your either host params or user parameters, whatever your vendor calls them, to customize your system to the way you're going to use it. And what it's doing in this phase, this testing, is that it's proving that the configuration you're making is going to work for you. So you're testing things that are set up in the configuration, making sure that your setup, the way you're setting it up, is going to work for you. Another similarity between testing and validation is that you always need a plan. I know we talk really heavily about having validation plans or scripts or different types of things that you're looking at, and we talk really heavily about that in validation, but actually there is no testing activity that you don't need to have some sort of a plan for. So in both testing and validation, you need a plan. You need to implement your plan as your plan is written, and if it's not correct, you need to change your plan, but you need a plan and you need to implement it. You need to fix the anomalies before you continue to the next step. In testing and validation, we'll talk a little bit more in detail about fixing anomalies because there are some differences. But in actuality, before you move on to the next step in the process, you do need to fix any anomaly that you come up with. And of course, some of them are going to be more important to you than others. That's going to be where your risk assessment is going to come into play. But anyway, the truth is, the similarity is that you do need to fix the anomaly before you can continue to the next step. You need to cover all the requirements you've made for this validation activity. So even in a testing phase, you're going to have certain scripts or plans that you're going to run or little test cases you're going to run, there's got to be some sort of requirement that you're testing when you're doing those requirements for your validation activity. So that's similar for testing and validation. You both need some sort of requirements for those two activities. And the same pool of people who do testing for you are probably good resources to do your validation. And the folks that do validation could be a good resource for you to do testing, because the two are pretty similar in these kinds of things that I've listed here. And now we're going to talk a little bit about the differences, but the people who can do both of these activities are actually probably the same people. So the next slide are the differences between testing and validation. And again, on the slides following, we're going to discuss these a little bit more. But some of the differences are the goals. The goal that you're testing and that you're performing or trying to get to in your testing is you're trying to get your system ready to be frozen, making sure that all of the requirements that you have for your processes in your system are working and the configuration is working the way you want. So the goals for validation are a little bit different because you're looking at highest risk and making sure there's very little risk in your system, and anything that is a risk in your system you're controlling with some sort of methodology. So the goals are different between testing and validation. For testing, you're trying to get to a frozen state. In validation, you're making sure that the frozen system, as it will go into production, is meeting all of your goals for risk, for being risk adverse, I should say. Also, the next bullet is timing. The time that you're going to do each of these activities, testing and validation, is going to be different. The scope that you're going to use for your testing versus your validation is different, and we'll talk a little bit more about that. But the scope for testing is going to be everything that you have an SOP to do, which is, I'm sure, everything that you do in blood banking that you need to use your computer system for, that is tested before you freeze your system, so you know that it's working the way your SOPs are written, or the way they will be written in the case of writing your SOPs after you finish your testing. But the scope for the validation is really supposed to be for things that have the highest risk or impact on patient safety. So scope for testing being everything that you've configured to make sure that it's working the way you expect. The scope for validation being the highest risk things that are going to cause patient safety problems. The system readiness, remembering that cyclic diagram I showed you, the system when you're testing is not ready, it's not frozen, it's still in flux. You still, if you find anomalies, with the next bullet point, how those anomalies are handled, if you find anomalies in testing, you can fix the anomalies and retest. But in validation, when your system is frozen, you need to document all of your anomalies and make a plan for how it'll be changed. But I'm sure you've heard this said, don't change the system until we finish the validation and unfreeze it and allow anomalies to be fixed. So that's totally different from testing, where you test, you fix, you test, you fix, you retest, you fix, and then you freeze. The change control status, again, that's the same thing. In testing, you're not under change control, so you can change things as you find them. In validation, you're validating a system ready to go into production. You need to wait until it's open, unfrozen, so that you can make your changes and then revalidate what's necessary. And also, I think this is the big one, the time spent planning versus implementing. So writing scripts versus running scripts is different between testing and validation. So let's move on to the next slide and talk about the validation testing steps prior to beginning the validation testing. So all of those other validation type steps or verification type steps you need to do before you start validation testing. So first, as I already stated, and I guess we can't ever overstate this, the system must be configured and frozen because the FDA expects you to be validating the system that's going to go into production. Change control mechanism must be established prior to the validation testing. Again, we're making sure that you're in strict change control, so every change that's made is assessed and you'll know whether it has an impact on the validation status of frozen status of the system. There needs to be a method for capture, review, and assessment of test anomalies. That should all be developed before you start your validation testing. And there needs to be a predefined acceptance criteria, which should be documented in some sort of plan that you put together. I think the reason we do this is that until you say what will be your acceptance criteria, you'll never know if you have a successful validation. So that's why you need to predict ahead of time what would be considered acceptable in order for your validation to be accepted. Let's talk about a few rules for testing, and this is really any kind of testing. Whenever you're doing testing, all your test results should be recorded permanently. The test results should be documented directly as the testing occurred and should be retained. And those kinds of testing documents might be screen prints, reports that you run, queries that you make, etc. So everyone has a different idea of what the documented evidence is to show that your system is validated. There should be testing summaries written, because as someone who's had to go in and do an audit after the fact, if I can read something that summarizes all that you did, what activities you did when, what you found, how you fixed things, and then how you had change control, how your change control policy worked, I can see easily that you're in a state of control. So there should always be some sort of a summary written that explains what you did. And test results should be reviewed and approved by a competent, independent person. So you would never want someone who runs the testing to be the person that actually reviews and approves the testing. It needs to be someone competent. By that I mean someone who actually knows about the system, knows blood banking. Perhaps this is the supervisor or the technical director, or even the medical director, depending on the size of the facility you're in. But someone needs to review everything and approve that it is okay for the system to go live, basically, in that approval. So let's talk about actually beginning your validation. What do you have to do? I mean, it sounds like a daunting task. We know that when you are required to do a validation, but my belief is if you have a quality plan, and I actually feel everyone should be able to write some sort of a quality plan that is reviewed with the implementation team to determine who should be doing what activities, and that's all documented, that's a good start. You need to learn the differences between the 3 different types of validation activities, IQ, OQ, PQ, and we'll go through that in a few minutes, and know what activity you need to do for which kind of either hardware, software, patch, etc. Make your assignments, so give people actual assignments and always give a deadline. I think we all probably know that deadlines help us to get the work done. Make a decision whether to outsource your validation activities, and do this early, because I think you'll find that if you use a third party and they're very knowledgeable about what you're going through, they can help you to make decisions about what needs to be validated, to make sure that you're in a state of control, and you know how to keep things from going out of control. And there's a lot of educational help you can get. So oftentimes people wait until the last minute to call and make a contract with a third party, but I can tell you that getting those people engaged early will help you in the long run. So I mentioned 3 different types of validation activities: IQ, OQ, PQ. Each of these is a little bit different, and we're going to talk about each of them, but as a whole, they make up the whole validation program. Installation qualification for your hardware, your printers, your PCs, your network, your barcode readers, your all other devices you use in order to use the system. You must do this. Each one builds on the other, so that's why we have IQ at the bottom. You must install, and we'll talk a little bit more about that in a minute. Install your hardware, your network, etc. OQ, operational qualification. That's where you're going to stress the riskiest parts of your system. And PQ, the performance qualification. This is where you add your people, your SOPs, and make sure people who will be using the system are competent. So let's go through each of the validation qualification activities and talk about each one as to the goal of the validation activity and when it's performed. So the goal of IQ installation qualification is to show that the automated system has been installed correctly and functions at a basic level as identified by the supplier of the device. So if you're qualifying a barcode reader, which we all are using a lot of these days, barcode scanners, barcode readers, however you call it. They're an important tool to making sure that you don't make typos, and which can cause an event in itself. So they're very important. However, if they're not installed correctly and they're not calibrated correctly to read the numerology or whatever is in the barcode, then you could have a mistake right there. So the goal is to make sure that all of the devices are installed correctly. When is it performed? Well, once the system has been installed, that's when you're going to qualify the equipment. That would include, as I said, hardware, software, databases, any files that get loaded by the vendor, barcode readers, printers, and network. So this is before you even begin any other validation, because the fact is, and actually some of us, me included, have found these out the hard way, that if you don't install your equipment and validate it, and then you have a problem later on in your validation processes, you'll never know if the problem is with your hardware itself. So installing and doing an installation qualification on your equipment can rule that out so that you know it's working. So anything that happens that I find that's not working correctly later on in my validation activities, I can be pretty sure it's the software or the configuration that I set up that's making it not work correctly. Who should perform it and who's responsible for IQ? Well, this is an area that you might ask your IT department to help you with. If you've ever been looking for, if you're a blood banker and you're saying, how can my IT department help me in my validation activities, since we all know it is a daunting task, you could ask them, could you please do an installation qualification according to the booklet that comes with my piece of hardware, and make sure that the hardware or the software or the database, whatever, is working the way it should. The blood bank is actually responsible that this gets done, but you can ask someone else to help you, like the IT department in the hospital. And the blood bank is, I would say, expected to have information, results, reports about this kind of validation, but oftentimes it might be, depending on who's doing it, it might be just a letter saying that all the equipment has been qualified. And how should it be documented? The evidence that it's been done is a little bit different. It's certainly not as thorough as what we do with OQ validation, but there should be evidence that all the hardware and software were installed correctly according to the manufacturer's instructions. Any details concerning any environmental conditions. For instance, it must be done in refrigeration. It can't be used more than 37 degrees centigrade. You know, it must have a cover over it, so that a dust cover, so that it doesn't get dust. Whatever. Those are environmental conditions that the supplier of that kind of hardware might give you, and you must prove that you are using it in those environmental conditions. And any findings you have from the installation qualification, of course, should be documented, just like any validation activity. Okay, the next validation activity is OQ. If you'll see the color turn to green. We tried to make this color-coded. The goal of this activity is that the process operating parameters are challenged to ensure they will result in a product that meets all defined user requirements under all anticipated conditions of manufacturing, and it's also referred to as worst-case scenario testing. The principles of OQ validation, software validation, here's just a few. That you need requirements. You have to have defect prevention, some sort of process for that. It takes time and effort. I'm sure that's no surprise to you folks. It's done during the software life cycle, as we saw earlier on my little cyclic diagram. You have to have plans. You should have procedures for how it should be done. There should be validation after any changes made. We call it usually revalidation. Depending on the scope of those changes, you would decide what you need to revalidate. It should cover as much of the things that could severely injure or kill a patient as possible. Here's one that is very important to the FDA, that there be independence of review. So someone else other than the people who built the system should be either performing it or review it after it's done. And there should be flexibility and responsibility. So these are all of the principles for OQ validation. Let's just talk another minute about independence of review. Validation activities should be conducted using this basic quality assurance precept of independence of review. The FDA goes on, self-validation is extremely difficult. When possible, an independent evaluation is always better, especially for higher risk applications. And I think we can all agree that a blood bank computer system is pretty high risk, since we know that if things aren't going to go right, we could actually hurt someone. So who and how much OQ validation is enough? I often get asked how much validation is enough, and there's really no one answer. So what I usually say is, for each server or system that must be qualified, this should be done once per facility or once per server or copy of the software if more than one facility is sharing the server. So in the case of OQ, and if you're a multi-site, you can do one OQ, assuming that you do a risk assessment and you make sure you're doing the most risky things that are in the system, but maybe not risky for each independent site on the system, but you're taking the system as a whole, since it's all together on one network. So one validation per facility if the facility is on each one has their own server, but if you're a multi-site, you could do one OQ for the server as long as you're taking all the highest risk into account. You should use staff who are familiar with the configuration of the system and who can predict how the system should behave. Since in OQ that's very important, that we predict the expected response. And it's preferable to use staff independent of the builder. We already went over the independence precept. And very detailed staff, I'm sure you'll be able to find people in the blood bank for this, very detailed staff who are good at making observations and noticing inconsistency in automated systems. When is it performed? Well, once all the configuration has been completed for the system, you should determine the processes that can be done by the BEC system, determine which processes you will be doing at your facility, and anything that you're not using, and I think this is very important, if it's turned on, then it should be validated, because someone might go in there and do something in there that could harm a patient. If you're not using it, then please turn it off or inactivate it so that no one can actually get in there. Okay, that's very important. And how should it be documented? Again, in OQ validation, we're very documentative. We use very strict guidelines for documenting. We have user requirement specifications. we'll do a risk assessment, and we meaning the blood bank personnel who are using the system or in charge of the system. Test scripts, inputs, our expected responses, a column to capture the actual results, putting in a pass-fail, and a cross-reference to the requirement being tested. So it's the responsibility of the blood bank to get these things done, and to make sure that whoever's doing your validation for you uses requirements, has a risk assessment, has test scripts. They have all these columns. They capture files or printouts that are stored with the documentation. There's a problem or deviation form, and there's documents summarizing the process and the findings. And ideally, there should be some sort of matrix that cross-references the validation testing to the requirements, because later when you have to prove your validation, if you simply show that sort of a document, the FDA and the AABB can easily see that all of the requirements that had the highest risk were covered in the validation. The last kind of validation activity is PQ. The objective of PQ is to demonstrate the computerized process, or what we know as the SOP, including your personnel, will consistently produce acceptable products or outputs under normally occurring operating conditions. So you are the best to know what your operating conditions are, what your SOPs are, where your workstations are, making sure that workstations can order, results will be passed back to the EMR, etc. And you're the folks that are best able to challenge your personnel to make sure that your personnel are competent to work with the system. And it's always performed right before live. Sometimes people try and do PQ at the same time they're doing OQ. I guess that works, but what I'm always afraid of is that if you train someone to do something and you do PQ with them to make sure they're competent, and then in your OQ something's uncovered that would change the way you have to set up your system, it's always harder to go back to people and say, oh, forget what I told you during that PQ. Now we're going to do it differently because we found out that didn't work in OQ and we had too many anomalies. I guarantee you the people who are trained are now going to be confused, which process am I supposed to use? So we always tell people to try and do this after their OQ is done, but that doesn't always work out. So just keep in mind that there might be a retraining needed if anything gets changed after we find anomalies in our systems when we do our OQ. So just keep that in mind. And who should do it? Well, each facility, if you're a multi-site, each of your facilities now is responsible for their own PQ. So I mean each facility, not each server, but each facility must perform their own performance qualification using their own people and procedures to ensure that their processes will consistently produce an acceptable output or product under normally occurring operating conditions. And again, if you're multiple facilities, we mean for this that each facility has their own SOPs and their own people, and therefore must perform their own PQ. And how should it be documented? Well, this is going to be a little different than OQ because your SOPs provide a lot of your documentation, your personnel training records and competency records, training manuals and other training materials that you use, any notifications sent out to the rest of the facility letting them know that your new system will be going live and how that will impact them is part of this documentation. If you're doing a data conversion, your data conversion's been completed and validation of the migrated data has been done and you have documentation of that. Your PQ validation results, any corrective actions that you had to take when you went to start training people in order to show that you're in control. You need some corrective actions and you need to prove you made those and that people were retrained. And a statement from your medical director that the system meets your minimum requirements to go into production. So all of those pieces of evidence together make up your PQ documentation. So just to summarize, let's now talk about the key evidence of validation that's in control. evidence of a frozen system used during the validation, and if changes were made, a reassessment of validation needed. That would be important to show that you're in control. Again, showing that you're in control when the FDA or the AABB walks in, if they get the impression you're in a state of control, I can almost guarantee you things will go easier for you than if they walk in and think nothing's in control. So we're showing them the correct, that they should get the correct impression that you are in control, and it starts with the fact that you froze your system, you validated, any changes you needed, you made them, and a reassessment of the rest of the validation activities that you need to do is made. You need a URS document, something that shows the requirements, and ideally that should become a matrix so you can show the cross-reference between the requirement and the scripts that were run to validate that requirement. You need a risk assessment so that you can prove that the things that you did in your OQ validation were the riskiest things that you have in your system. That you need system documentation for the version you validated, so you must get that documentation and keep that as a record of how your system should have performed. You need a quality plan. I've never been to a facility that doesn't need some sort of a quality plan that describes how your validation will be performed. For I2, you need documents from the vendor of the hardware and software that you're using to prove that it met your the way you installed it met your manufacturer's documents for configuration, etc. For OQ, you need scripts, test cases, some sort of way to mechanism to capture the screen or the output to show that it was as expected or it wasn't, and how it differed. Problem forms, what you did as your corrective action, and summary documents. And for PQ, you need training records, documents such as checklists, test plans, etc. So before we talk any more about the references or I take questions, I just want you to go back to think about the first cyclic slide I showed you, where we had the testing before the freeze and the validation after the freeze. In actuality, if you've, I think you've heard through this presentation I've given, those two, validation and pre-validation testing, are really similar. The only difference is the timing, how the system was, whether it was frozen or not, and how you handle anomalies that come up during that sort of testing. And otherwise, I mean, the same people can be used, similar test plans can be used, although OQ validation is much more documentative than testing. And I hope you could see those differences. And these are the references I used for this presentation. I tried to leave enough time for questions. We've got about 20 minutes. And we'd be glad to take any questions.
Thank you, Robin. This is Molly again. We did get a couple questions, and again, out of respect for everyone's time, I will try to get a couple questions answered here and get everyone who's trying to get lunch in and all their other activities done for the day back. So one question you did answer a little bit, but it's becoming so prevalent, I wanted to throw it back out to see if there was anything else you wanted to add to it. We had a question about a hospital that is being put on the same database with 5 other facilities, and just wanted to know if you wanted to add any more information about performing the OQ validation in that multi-site situation.
Okay, yeah, sure. We're coming across more and more multi-sites in this day and age, so it is becoming a question we get a lot. Well, the first thing is you need to look at all of the systems and what the differences are in the configuration. Most of the time, we are working with sites that try very hard to have the same database across all facilities. And if you can do that, that's probably the best way to handle the system, so that if everyone's using the same database, then the people who are in control of the system will have an easier way to keep track of what's going on with the system. But what we find frequently there are differences. When we do OQ, we're looking at the system as a whole. So we're looking for the riskiest things that are in the system, and we may not hit every different combination of how a system can behave if things are defined differently. But what we try and do is hit the things that are actually the most risk or will cause you the biggest issues if they're not working correctly. And then what we tell multi-sites is in their PQ, when they're training their people and they're actually using the process for that particular facility, if you simply use more documentation around the things that weren't covered during the OQ because the system as a whole was taken a look at when risk was determined, then, and you document that all of your people were trained in this process and your training included things that were not the usual thing, like someone who has an antibody, someone who has multi-antibodies, etc., when you're doing cross matches, perhaps, then you would be stressing everything that's in the system. So we take the system as a whole, we do a risk assessment on that whole system in OQ, but in PQ you're stressing your system as your system will be used by your people and your SOPs. And so that's how you can use both of those validation activities to complete your validation in a multi-site. I hope that answered that question. It is comprehensive and kind of critical and also kind of confusing. So if there's further questions from that, I'd be glad to answer them through email.
Thank you, Robin.
Okay.
We've got one more question that we can go over today unless something else comes in. Again, another common situation, say they're going live with Epic on the same day as their blood bank software. So the question is, when do they do Epic integration testing? Is that before OQ validation or after?
Usually, yeah, okay, that's a really good question. Yes, I would say that's definitely a before validation and before that freeze line, because if you start doing Epic testing, and I've done that myself, so I'm pretty familiar with that, and you find that some process that you had designed that you thought was going to work a certain way, and you were going to use the system with certain configuration settings, and then during your Epic testing you find out, oh gosh, those settings are just not going to work that way for Epic to get the results to Epic or get the orders into your software system, then you might need to make a change to the configuration. And if you have to make a change to the configuration, you'll have to test that and make sure that configuration works the way you expect. And then you can do your Epic testing and see if that works. So usually the testing, pre-validation testing in your blood bank software and the Epic testing can happen at the same time, and they might be happening just hand in hand. So you change things in your software in blood bank and then test it again to see if it works with Epic. Definitely not after you decided to freeze the system. By then you should have that testing done, because if you need to change the configuration in your blood bank software, you will need to reconsider what needs to be revalidated, and it's more intensive to do a revalidation than it is to do testing, find out something didn't work, fix it, and retest. So that's what I would recommend.
All right, thank you again, Robin. I will go ahead and let everyone know that we will send these slides out to anyone who attended the webinar, and the answers to the questions as well. I hope everyone found today's information valuable. Thank you, Robin, for your time and your expertise. If anyone wants to contact Robin directly, her email address is on the screen, or you can contact BC Solutions, and we're happy to get you in touch. I hope everyone has a great afternoon. Happy March 1st, and welcome to spring. Hopefully it'll be there for everyone soon. Again, thank you.
Thank you, everyone.